I'm so proud of the way people are working together across the system to improve quality. And doing things that are more convenient for our patients, help to lower costs, and honestly make the entire system simpler to use.
Sarah, you've spoken about how much we accomplished together in 2018. What really stands out in your mind about last year?
So when I look back at 2018, I am so proud of what our employees and physicians and other caregivers did together. If I had to say one thing that really stands out to me, it's the improvements that we continue to make in quality and service in a year when there were all kinds of things happening externally. We had fires that affected some of our hospitals. We have a lot of discussion at the state and national level about healthcare, and our employees, our caregivers, our physicians, they came in every day and they just took amazing care of the people that we serve.
I think you see that across our system. Can you just maybe talk a little bit about, no matter where you go in Sutter, we just have this huge dedication to safety and to quality?
So just a couple statistics that I think are really wonderful. One is sepsis. So sepsis is a major killer of people in hospitals, people who are very ill. It has a very high mortality rate. And our sepsis mortality rate dropped by almost 60% since we've been working on our system-wide initiative. So you look at the patients' lives that were saved, the suffering that was avoided, we should be so proud of that. And we could talk about that with C. diff, we could talk about that with ventilator-associated pneumonia. So much to be proud of in the way people are working together across the system to really improve quality. And we have a strong commitment to improve access and doing things that are more convenient for our patients, help to lower costs, and honestly make the entire system more seamless, simpler to use. 5 years ago, a small fraction of our medical appointments were booked online. Really a very small number. Last year, 1 million appointments were booked online. We've opened over a dozen walk-in care clinics in the last year. I personally have used them. Wonderful, convenient. They work well with our physicians so that if there is a problem that needs a higher level of care, there's that seamless ability to make that follow-up appointment. Last year, we opened our new campus in San Francisco at Mission Bernal, and this year we opened our new campus at Van Ness and Geary.
We've been able to make those investments at the same time as we continue to improve on affordability. And quality, access, affordability, as you mentioned earlier, kind of go hand in hand. What else on an affordability front is kind of happening that maybe a patient might see or experience?
Yeah, we're constantly working to improve affordability. And if you look at the last 3 years in both our medical foundations and our hospitals, our cost per patient stay or our cost per visit has gone up by less than the cost of inflation. The other thing to patients is they often are very confused between what their insurance company pays and their personal responsibility. And that has become more of an issue as more people have high deductible plans or as there's more co-insurance and co-payments. And so we do have an online tool that patients can use that's an interactive tool where they can actually get upfront estimates. And the other advantage, of course, when a patient calls us is we have a very generous charity care policy for people who don't have the means to pay for their care. And so when they do approach us and let us know that they have a need, we can help them. And we can feel really good about the fact that we can help them.
Sarah, can you talk more about just our not-for-profit mission and what we've done in our communities in 2018?
It's so many different things, right? It's everything from the fact that we care for more of the poor than anyone else in our Northern California footprint, to the programs that we continue to expand to help take care of the homeless, which is a growing problem in almost every community in Northern California. It's the response that we had during the fires. It's the way we worked with the community. It's the way we worked across the network. Our commitment is really to be there for the long run for the people that we serve. And it's preserving this incredible community asset that has been in many of these communities for 50 years and some of them 100 years. I'm so grateful to be part of a system that does that.